Welcome to the CNSA Global Health Committee podcast series. Throughout the series, we will be interviewing different nursing leaders to provide listeners with a glimpse into current, local, and international global health initiatives. We hope to provide students with a greater understanding of global health and to inspire students to pursue paths that will enable them to become future leaders in global health. We hope you enjoy. Good morning, Mona.
Good morning, Katie.
How are you feeling this morning?
Oh, I'm feeling great, thank you.
Thank you for being a part of our podcast project. We're really excited to have you here. Just to start things off, can you tell us a bit about your background in nursing and how long you've been a nurse for?
Oh my goodness, I've been a nurse for a very long time. This year, in July, I celebrated 37 years in nursing.
Wow.
Yeah.
That's wonderful.
It's been terrific. So I graduated in 1979 from the diploma program here at True, which was Caribou College at the time. And then years later, decided to do my baccalaureate at UVic and then my master's at BC.
Wonderful. And what drove you to pursue a career in nursing?
Well, I think back on that, and I think the thing that stands out for me most, I always was struggling with whether I was going to go into teaching or nursing. And then my last 3 years of high school, I had really great summer jobs at a residential mental health facility called Riverview in the Lower Mainland, which is now closed. And that's a good thing because it's become more community oriented. And I think the working with that population really steered me towards a career in nursing.
That's wonderful. And what got you involved in global health specifically? Topic of today.
Yes. Well, I was an emergency room nurse for a number of years, and then I did a complete flip-flop and went to public health nursing, which now is my first love in nursing. It broadened my whole view of healthcare. And part of my role was the maternal child program, where we were doing a lot of home visits in the postpartum period, as well as supporting families and family functioning. And what I learned was that there are so many different norms out there for postpartum healing and families in transition. So I was visiting families from different cultural, ethnic backgrounds, and I was learning from them what their norms were and some traditional medicine. And I was intrigued because I had typically not worked in a multicultural environment. So I was intrigued in it, and it drove me to learn a little bit more. And then when I started educating here at True, I had the opportunity to join the Global Health Committee and learn a little bit more. And then I started teaching community development. And of course, community development it's the whole world. So I was able then to continue to learn about multicultural environments and ethnicity and how the community works on the global level.
Yeah. So it's definitely that curiosity and that working with those moms and families that drove you to pursue.
Absolutely. They were my biggest source of learning. Yeah. Really. So I'm very grateful for that.
And so now you're involved in the Global Health Committee and you're teaching courses at TRU here. Are there any other initiatives that you're involved in right now for global health?
Well, I partner with True World, so whenever there's an opportunity to bring a new partner on, for example, Australia, the University of Canberra, we have students this year. It's our pilot project.
Yeah.
So I visited last year.
I've met some of them.
Yes, we have two. So it's baby steps. It's our first year with Canberra. I think it's going to work out very, very well. So we're constantly looking at ways to have more student opportunity and reciprocity with other institutions around the world.
That's very cool.
It's very cool, yeah.
Yeah, I get to see what we're learning in different areas of the world.
And you know what is really encouraging is that there's so many similarities across the world with nurses. There's more similarities than there are differences.
Yeah, that's wonderful. That's good to hear.
No, it is. And nursing philosophies in their in their countries are very similar. I mean, the heart of it is caring, right?
Right.
Yeah.
Yeah. And what do you see right now as one of the most pressing issues in global health, or something that maybe with the students and getting that international exchange, are there issues with that, or?
In terms of having students come to us and our students go other
what's
places?
been most difficult with that? I mean, it can't be easy.
Well, no, and it's a very lengthy process.
Yeah.
And what drives us is more students applying than there are seats for. Because we don't want students not having an opportunity if there's a potential there. So we start the process, and it does take a little while. So a lot of it comes down to where each institution is actually at, and in terms of funding and curriculum, where's a good fit for students to fit into somebody else's curriculum and still have the learning outcomes for their semester or for their experience. So how do we do that? And I think nurses are really good. We're flexible, and we understand where we need to consolidate growth in students, whether you're from Australia or from here or from Samoa. So it drives us to be a little bit more creative in how we can help them achieve those outcomes.
Right. Yeah, we're very good at being flexible nurses.
Yes, we have to be.
It's one of our good skills.
Yeah.
Can you tell me about the international practicums you have led, and
sure,
how you got started with that?
Well, when I started to work here at the university, and because my curiosity was really piqued, as I described, and I knew that there were opportunities, I thought, well, I'll apply, because I had a strong background in acute care, and I had a strong background in community health. So I thought, well, those are great skills to have when you're going somewhere.
Definitely.
And so I applied, because there were two groups going to Samoa, which is in the South Pacific. It's halfway between New Zealand and Hawaii. So it's geographically paradise. It's also a developing country. So I applied, and I got the position, and I was mentored into it by a faculty member named Marilyn Schigel, who really developed the program. So a lot of the credit goes to her for how this has all evolved. So time has clipped by, and sometimes we have one group and sometimes we have two, and I've become the clinical lead for probably the last 5 or 6 years there. And so I go every spring with a group of students, anywhere from 6 to 8 students for 5 weeks.
Wow, that's very, very cool. So how long has it been running for then?
I think we're in our 13th year.
Wonderful. We must have such a good relationship with them by now.
And you have said the key thing. It is that relationship that we have with the country. And sometimes developing countries have a lot of NGOs that come and go. They come and go. And volunteerism, it's a fantastic thing, but sometimes it's not sustainable. And things cost money, and so it's really important to countries that people come back. And that's one thing Samoa says about the true School of Nursing, is that you always come back. So we've developed a very good partnership with them. We've done one research. We've had one research opportunity, which Marilyn did with the last dean there, and it was post-tsunami mental health, post-traumatic stress. And they were able to present in Malta at the ICN a few years ago. So, it's incumbent upon us, when we build a relationship with a country, besides our student experiences, that we also look at research together, faculty opportunities. How do we make it richer for the entire university? Absolutely. And students and nursing courses are something we all do well. Faculty do well at that, students do well at that. So we really do need to start looking at those other opportunities. Faculty exchanges, an opportunity to bring your skills, to another country, and theirs to come here.
That would be very, very cool opportunity.
So it's really been, I'd say that's a highlight of my career. Is having that relationship with Samoa, and our reciprocity, which is so important whenever you work with a country that other people feel are have-nots, or that aren't as resource-laden or rich. That's not always the case. They are so rich in other areas. And we have to be very careful that we don't take. And I don't mean in a physical way of taking things away from their country or their area, but the drain on resources there, as you're always asking nurses questions about their culture and their practice, and the reciprocity is so important to us that work in global health. And as I talked earlier to you about our students that are coming from Samoa every second year, and we host them so that they get an understanding of global health issues from somewhere else.
Yeah.
And so that has felt very good.
Mm-hmm.
You know, we feel good about the relationship because we are indeed giving back.
Yeah. Definitely. I think it's a wonderful thing that you're doing. Very, very exciting.
Yeah, it's been very rich in learning for me as well.
Yeah.
As the students, I'm learning as I go.
Definitely, yeah. Yeah, it'd be hard to go somewhere like that and not just absorb all that learning.
And just when I think I have an understanding of a piece of the surface culture, I don't.
Yeah. You're like,
and then,
maybe I get this. Oh,
no. And then I'll see just a different bend in it. And, and I'll talk to my Samoan colleagues again about what this is like. And typically it's a deep-rooted cultural norm.
Mm-hmm. Yeah, definitely. Yeah, they're very, very, rooted. You just see the surface of the painting or the clothing, but you don't see...
Or the songs.
But you don't see what's really rooted behind that. And I guess after being 13 years with them, we maybe get a little bit deeper of a picture, which is cool.
Yes, and I think that may be a mistake made by anybody that goes to work in a new country, is the lack of recognition on the importance of culture on a nation's, individuals, communities' health and healing. Mm-hmm. That has been the key takeaway for me, is that it's culture.
Yeah.
And, if you don't understand it, you're not going to do the work in an appropriate way.
Yeah. How much our health is tied to our culture.
Absolutely.
That blew me away last year when we were learning about that. Yeah.
In your global health course.
Yeah, and in community too, we talked about it. And it was just, you don't really think about that as much. You think about the path, though, and the farm, because we're also tied up with it.
Yes.
But, to really think about the culture.
Yeah, and what we hope from learning for students is that they not necessarily need to go away on an international practicum, but to take that learning, take it in, take hold, so that when they're working, even in their home communities, where culture is such a big part of somebody's life, to understand, you don't need to know all of the ins and outs of that culture, but to understand that there's an overarching cultural theme. Yeah,
that was something I was thinking about as well when we were talking about this. It's not just in Samoa or overseas, it's here. Global health is
absolutely, and our First Nations communities, and that's a very strong culture.
Yeah.
Yes.
Absolutely. Is there anything students you think, though, could learn from an international practicum that they couldn't learn in their local communities?
Well, I think that the practicums that we go on, that we do our consolidated practicums within, are cultures that are very homogenous. So they are, for example, the Samoan culture, 93% people are Samoan, where you don't see that in our country. So it's just simply an opportunity to work with a very culturally rich group, so who are all pretty much with a view and a focus, and, for example, on family and the importance of that in health and healing. So those type of opportunities are really great learning. A consolidated practice experience is rich, whether you do it here in Kamloops or you do it somewhere else. The students really, that's really where it comes alive for students.
Yeah.
They feel like nurses after that experience.
Totally, I agree. Is there anything you would recommend to students to get involved in global health if they're interested in it? Any programs, organizations, or?
Well, I think our third-year global health course is a really great starting place for some students. Other students have had different experiences with travel, volunteering, doing some humanitarian work. So I think the opportunity to learn and grow in that course, to have the opportunity to research and develop your paper and your group projects in an area that takes you out of your comfort zone, to learn a little bit more about. And I think locally, in terms of our campus, there's a lot of activities through True World. And I know that this year, International Days, which have been running for a number of years, and they're typically they're culturally aware, awareness activities. This year, they're changing it a little bit to have the activities reflect the Sustainable Development Goals.
Oh, so cool.
Yeah,
I
so
didn't know that.
they're structuring it differently this year. They're kind
Yeah.
of taking it down a different avenue. But what it's doing then is bringing awareness to these goals, so, to these SDGs, and of course students are learning about them all the time. So this is a chance for students to really get involved and see what's going on out there.
Wonderful.
And more involvement with the World Health Organization, United Nations, very big groups that are really active, globally.
Yeah.
Yeah.
Definitely. Just one last question for you. Do you have any other advice for future nurses before we end off here?
In terms of global health?
Yeah.
Well, I would say that if anything tweaks your interest and you're thinking, that you need to follow that. If it's a passion, there's many opportunities. In our nursing program, you have the opportunity for different types of practicums. So, we have our study abroad, which is Norway and Australia. We have our field schools, Belize, the community development course, as well as our consolidated practice experience. So currently it's Samoa. That's the country we're working with right now. So those are opportunities. Sometimes that's not a good fit for all students, though. We have students at various ages and stages. So if you have young children or there's financial issues, which we completely get, we understand that. Or it's just maybe not your thing right now. Going away for long periods of time, it's not for everybody. But there are opportunities within your local community to volunteer with different groups. We do have a multicultural society in Kamloops. Yeah. You can volunteer to be a part of international days, and to know that we're currently working on more international opportunities for students that might not necessarily mean going away.
Yeah.
We're really at the beginning stages of, for example, working with our partner in Canberra in Australia, so that we can do virtual experiences. So maybe have classes together.
That's so cool.
Have students in Canberra critique and give feedback on a project that you're doing in one of your courses here.
Yeah. Very cool.
Perhaps compare and contrast health issues for both of our Aboriginal First Nations communities. To see the similarities, where we are politically, the history. So we're working on that. Because you don't need to leave the country to have an international experience.
Yeah, definitely.
You don't. So I think most academic institutions are recognizing the value of international practicums.
Absolutely.
And so most are committed to having these experiences. And with today's technology, there really isn't a good reason why we can't do it.
I know.
20 years
they
ago,
make it too easy.
It would have been pie in the sky.
Yeah.
But now, really, there's no reason not to commit to having more opportunities for students and for faculty.
Yeah, definitely. So that's kind of an international standard for learning and standards of practice too, which is really cool with that it's at a global level.
Yes, and now students are wanting to learn, and we want them to learn about health systems, what that looks like around the world. Yeah. For example, when we talk about primary health care, and the principles and the values behind primary health care here in Canada, in other countries, they also work under primary health care. But how does that look within their cultural, their cultural homogeneity maybe, or their cultural outlook, or their traditional medicine, their alternative ways of healing? So they still are practicing primary health care, but it looks a little different.
Yeah.
Although when you really look at it, their values around inclusiveness and social justice, all of those things are still the same.
Yeah.
Yeah.
Definitely.
And that's encouraging.
Yeah.
To know that we're all kind of in the same boat, people.
Yeah. Our values are all kind of the same,
yes.
but it just looks a little bit different, which is really nice to see that it's...
And due to funding, because everything's about money in healthcare, really,
yeah.
To get new initiatives going. Sometimes it's just it's a lack of resources, whether that's human resources, physical resources, essential medications. It looks a little bit different that way, and what area they live geographically, but underlying it all, there's a lot of similarity.
That's very nice to see. Well, thank you, Mona, for taking the time. Is there anything else you'd like to add, or?
Well, I think that I'm really encouraged that CNSA has their own global health committee to start working at that level, and that raises so much awareness for students. And it's not just faculty going into class and doing that teaching, it's also their peers that are valuing it and bringing it forward and bringing issues forward. So I would like to see, a little bit more melding of our School of Nursing Global Health Committee, with yours, because there's a tremendous amount of learning that can be done for both of us.
Yeah, definitely. I'm sure we could learn a lot from you, and hopefully maybe show you too.
Well, for sure. Yeah, no, we very much value what we take away from students as well. I mean, it's a collegial relationship.
Yeah, that's definitely something we should talk about further.
That sounds great, and I'd be very interested to do that.
Okay, well, thank you, Mona. Well, we're signing off now, but thank you all for listening.
Thank you.